Assalamu alaikum. Today we will discuss about lobular carcinoma in situ of breast. In the previous video of ductal carcinoma in situ of breast, I have told you about the morphological classification of the breast carcinomas, and I would highly recommend that you must watch that portion before starting lobular carcinoma in situ. Actually, lobular carcinoma in situ is again by definition as it is carcinoma in situ. In every type of carcinoma in situ, it doesn't matter that either it is of breast or it is of cervical carcinoma or whatever it is. If it is carcinoma in situ, it means that the carcinoma that remains confined or that doesn't invade the basement membrane is carcinoma in situ. And lobular carcinoma in situ, as I have stated in ductal carcinoma in situ, that the DCIS was also a misnomer. Similarly, this lobular carcinoma in situ is also a misnomer. As its name indicates that maybe this tumor remains confined to the lobules, but no, it doesn't remain confined to the lobules. It involves both the ducts and the lobules, but because here the actual lobular configuration or actual lobular architecture of the lobules is retained, that is why it is lobular carcinoma in situ. I have told you before, but again I am telling you that terminal ducts of 3 to 5 acini and acini together meet and they form a lobule. Okay, so lobular carcinoma in situ, not only this terminal duct and lactiferous ducts are involved, but as well as this lobule is involved. But because this lobular architecture is maintained here, that is why we call it as lobular carcinoma in situ. Okay, I hope so this will be clear. Now let's move towards its morphology. Here you can see, as in this picture, it is clearly depicted in this picture that uniform cells are present here. Here are monomorphic cells which can be seen easily. I hope so that you will be appreciating it, that here uniform cells are present or monomorphic appearance of the cells can be easily seen. Number two feature is that here ecadherin is absent. Ecadherin is responsible for the adhesion of the cells, and so here there will be no adhesion of the cells. And if I zoom it out more, then you can see here that these cells are not joined with each other, they are not adherent with each other, and this is a characteristic feature of lobular carcinoma in situ that will be absent in ductal carcinoma in situ, right? And here number third feature is that here intracytoplasmic vacuoles are present. All of the things which I have mentioned here, they will not be seen in the ductal carcinoma in situ. In ductal carcinoma in situ, there will be no loss of cohesion, as in the lobular carcinoma in situ. Lobular carcinoma in situ, loss of cohesion between or loss of adherence between the cells can be seen. Number two feature is that only lobular carcinoma in situ intracytoplasmic vacuoles can be seen, or we can say that mucin positive signet ring cells can also be seen in this carcinoma. Here you can see that this is the nucleus, it is pushed towards the periphery, and this is the rim of the remaining cytoplasm, and here a vacuole is formed where mucin can be seen. So it is mucin positive signet ring cells, and these are characteristic feature of lobular carcinoma in situ. Let me show you in a picture. uh, Here, I hope so that you can appreciate it, that here somewhat signet ring cells are present, like here, here, where nucleus is pushed towards the periphery. This is another signet ring cell. Okay, here you can again see, and here you can also see that loss of cohesion between the cells is present, and there are uniform cells are present, and here cells are also confined to the basement membrane, or they are not invading the basement membrane. Here is another picture of lobular carcinoma in situ. So that was all about the morphology of lobular carcinoma in situ. I'm again revising its features. Number one is that loss of cohesion can be seen, and these features are not seen in ductal carcinoma in situ. So I am telling you the difference between ductal carcinoma in situ and lobular carcinoma in situ. In lobular carcinoma in situ, is number one is that loss of cohesion between the cells can be seen. Number two is that intracytoplasmic vacuoles can be seen, or mucin positive signet ring cells can be seen. Number third is that it is bilateral in most of the cases, but ductal carcinoma in situ is unilateral in most of the cases. Number four is that multicentric lesions can be seen in lobular carcinoma in situ, and vice versa in DCIS. And number fifth feature is that here pagetoid ductal involvement is more common. I will tell you that what is pagetoid ductal involvement, or pagetoid or Paget's disease of the breast. Okay, so that was all about lobular carcinoma in situ and the TCIS difference. Okay, what is Paget's disease of the breast? In Paget's disease of the breast, actually, as you can see in this picture here, this is a picture of your big robins. Here you can see that this is the duct, lactiferous duct, and here is the lobule. We can say that it is lobule. So ductal carcinoma in situ, or either it is lobular carcinoma in situ. Here, as you know, that carcinoma like cells are present or cancer cells are present, so they start invading this lactiferous duct and they cross it without crossing this basement membrane. Outside it, this is the basement membrane. These cells are not invading this basement membrane. By remaining inside this basement membrane, these cells are spreading here towards the lactiferous duct, and from here they are they reach towards the epidermis, and they can be seen here in light blue color. Here in sky blue color, you can see that in the cells of the epidermis, their Paget cells can also be seen easily, and these Paget cells are responsible for producing and these pegyroid cells are responsible for breaking the epithelial cell barrier here. So extracellular fluid seep out from here, and it goes over the skin and forms scaly crusts on the skin surface, right? So Paget's disease can be seen as erythematous eruption, and it is in most of the cases unilateral, and it is very rare manifestation of the breast. In almost 1% to 4% of the cases it can be seen. But this pagetoid spread is more common in lobular carcinoma in situ as compared to ductal carcinoma in situ. So that was all about lobular carcinoma in situ. Thank you very much.